Hello friends, and welcome to our today's lecture on cardiac hypertrophy. So this is a small chapter and it will be completed in one lecture only. So first of all we will start by understanding meaning of hypertrophy. What is the meaning of hypertrophy? So hypertrophy means the enlargement of an organ or tissue from the increase in size of its cells. So you already know the meaning of hypertrophy, that is it is only increase in size of cell, it is not increase in number of cells. Numbers of cells remain same, only their size is increased, it is known as hypertrophy. So again, from this definition we can go for cardiac hypertrophy, and cardiac hypertrophy will mean the enlargement of heart from the increase in size of its cells. Okay. Basically cardiac hypertrophy means an increase in size and weight of the myocardium. Why only myocardium? Because most of the heart is made of only myocardium. So increase in other cells, size of other cells will not affect the size of heart too much. But if myocardium is increased in size, cells of myocardium are increased in size, then heart will be enlarged. So basically cardiac hypertrophy applies only to myocardium, hypertrophy of myocardium. And what is the cause of this increase in size and weight of myocardium? It results from increased pressure load. Myocardium size increase results from increased pressure load. So what is pressure load? So pressure load increased pressure load or pressure overload refers to the pathological state of cardiac muscle in which it has to contract while experiencing an excessive afterload. So increased pressure load or pressure overload means it is a pathological state of cardiac muscle in which it has to contract while experiencing an excessive afterload. So cardiac muscle contract to push blood into the body, but in pressure overload they have to their force of contraction should be their force of contraction is increased because there is an excessive afterload. So now you will be a little bit confused, but after you look at what is afterload, it will be clear. So what is afterload? Afterload is the pressure that the heart must work against to eject blood during systole. So afterload is the pressure that the heart must work against to eject blood during systole. So during systole, ventricles contract and push blood into the body, but they experience some pressure against which they have to work. What is this pressure? Let's see. Here I am making a rough diagram of heart. This is ventricle, right ventricle, this is left ventricle, and from here aorta arises. Okay, so this left blood in this left ventricle is pushed through this aorta in this direction. Okay, so and here is 1 minute. Here there are valve which keeps blood in aorta to from flowing back into ventricle. Okay, so during systole what happens is this wall is pushed open due to force generated by contraction of systole. This wall is pushed open and blood goes into aorta. Like you can consider like a door. This is a door, and you behind the door there is some fluid or something. So when you want to open this door, you have to push it back. and if the pressure behind this door is much greater, then you have to push with a greater force. Okay, so consider there is a room which is filled inside with a liquid, or which is filled with water. So when you are trying to open the door, and the door is type which is not pull type but push type, so when you are pushing it, the water from inside the room will also exert pressure on door, so you will have to exert some force. And if the pressure inside the room, water pressure is increased, then you will have to exert more force, more pressure to open the door. That is the same thing happening here. That is the afterload. The pressure of water in the room is afterload. Same thing happens in HUD. So there are other factors also, but here consider only pressure of water in the room. That is the pressure of blood in the aorta is afterload, and you will have to push open the valve to push further blood inside aorta. So this is a simplified version, just to understand. So now coming back, I hope you have understood what is pressure overload and what is role of afterload in pressure overload. So basically this is what happens is that when heart muscle have to exert more pressure, they have to exert more force. So basically they are working more than normal. The amount they are working is more than normal. Like if a person is exercising in a gym, so his muscles are working greater than normal. So slowly his muscles are increased in his cells are increased in size, and this is called as hypertrophy. So that same phenomena is applied here. Here also cardiac muscles are working excessively, so their size is increased, and it results in hypertrophy. I hope you understood it. Now coming to causes, so I will just read the causes of cardiac hypertrophy. So causes are divided in according to left ventricular hypertrophy and right ventricular hypertrophy. So first of all, left ventricular hypertrophy. Causes of left ventricular hypertrophy, they are systemic hypertension, aortic stenosis and insufficiency, mitral insufficiency, coarctation of aorta, occlusive coronary artery disease, congenital anomalies like septal defects and patent ductus arteriosus, and conditions with increased cardiac output, for example thyrotoxicosis, anemia, arteriovenous fistula. And now what are the causes of right ventricular hypertrophy? They are pulmonary stenosis and insufficiency, tricuspid insufficiency, mitral stenosis or insufficiency, chronic lung diseases, for example chronic emphysema, bronchiectasis, pneumoconiosis, and pulmonary vascular disease, etc. And last one is left ventricular hypertrophy and failure of the left ventricle. So this here the chapter on cardiac hypertrophy completes, and I hope that you have enjoyed it. And if you any point is not clear, or if you want to elaborate further on any point, you can ask in comment section. Thank you. See you in next lecture.